Hi, I'm Lisa Smith, Research Associate at the William Davidson Institute's Healthcare Research Initiative. I'm here today with Amy Lehman, the founder of the Lake Tanganyika Floating Health Clinic, and we are thrilled to have her here today to hear more about her experience in global healthcare. Welcome, Amy.
Thank you.
First, could you tell us a little bit more about your organization, the Lake Tanganyika Floating Health Clinic?
Sure. So the Lake Tanganyika Floating Health Clinic started about 3.5 years ago, and our overarching goal is to build a regional hospital on a ship that goes up and down Lake Tanganyika, which is the longest lake in the world, to access all the populations who live around the lake and are otherwise inaccessible. What we do now is these discrete outreach projects in the 4 countries around Lake Tanganyika, where we begin to address some of the most pressing, public health, medical related problems.
Yeah, and you mentioned access being one of the issues, but what are the specific kind of needs within this population, like health needs or otherwise?
So the lakeside population around Lake Tanganyika is about 3.5 million people, but almost 12 million people live in the Lake Tanganyika basin, and it's one of the most inaccessible places really on Earth. It's in the middle of sub-Saharan Central Africa in the Albertine Rift, and it's surrounded by these relatively tall mountains, and the road infrastructure around the lake is poor to non-existent depending on the country that you're in. There are 4 countries around Lake Tanganyika, the Democratic Republic of the Congo, Tanzania, Burundi, and Zambia, but it's really eastern Congo and western Tanzania that make up the majority of the coastline. So you have these millions of people who live in this very inaccessible location, who suffer from things like malaria. Malaria is still the #1 cause of death in the basin, unlike many other sub-Saharan countries. Maternal child health is a major problem. We basically have, depending on the region that you're talking about along Lake Tanganyika, between a 20 to 25% under 5 death rate. We still have cholera, we have measles outbreaks, we have populations that haven't been vaccinated. So sort of standard infectious diseases that have been eradicated in many other places are still present there. We have problems with things like burns, for example, because for the most part there isn't any electricity around Lake Tanganyika, so people are using open flame and kerosene for light and to cook food. So kids get burned really with a lot of frequency. Typhoid perforations, lots of parasites.
Yeah. So based on all of those needs, how do you decide which services the clinic will offer, or what process goes into that, and do you have plans for a whole portfolio of services?
Well, we have plans for a whole portfolio of services, and we work very closely with the local ministries of health and the little dispensaries and health centers that dot Lake Tanganyika that have trouble with supply chain to get medicines and equipment into the region, as well as educational enhancement for people who staff these little outposts. We initially got started doing service provision in the malaria space because malaria is the #1 cause of death. And it's sort of a low-hanging fruit where if you do the right kinds of combination of education and prevention through use of bed nets, et cetera, you can have quite a lot of impact without the need to have a lot of technology. However, we just did another outreach where we were doing fistula repair for women who'd suffered from obstetric fistula, which is much more of a specialty surgical service. And we just made the plans to, build the capacity to do that along the lakeshore. So we're trying to address the problems that really are most pressing, but at the same time, with the hospital ship, we should be able to address any number of problems, both basic and of a specialty nature.
Okay. And you mentioned some community involvement. What kind of innovative methods have you used to engage the community in the work that you're doing for buy-in or for ownership and sustainability?
I mean, I don't actually think that community involvement is innovative at all. I think it's practical and normal, and what all people who work, in, rural settings need to do.
Yeah.
And so what we do is we go there.
Yeah.
And we talk to people. And we talk to people who work there. We talk to healthcare workers. We talk to people who provide other kinds of social services. We talk to community members. We talk to patients. And we try to understand, okay, what's happening here? What are the problems? What are the problems that you face as a mother who lives in this village along Lake Tanganyika? What do you need that you can't get? We talk to nurses who staff these far-flung health centers along Lake Tanganyika, and we say, how do you do your job? Or how are you unable to do your job? Things like that. And just in the course of our, presence in the basin and our desire to be collaborative, I think we've, developed very, very good, relationships with these communities. But, I don't think it, it's just common sense.
So now I know you have your medical degree and a business degree, but can you tell us more about your path, both educational and otherwise, to where you're at now and the work that you're doing? Like, what brought you to develop this type of floating clinic?
Well, when I went to medical school and business school, I didn't think that I was going to be building a hospital ship on Lake Tanganyika, I can tell you that. I actually spent 10 years of my young adulthood working towards becoming a general thoracic surgeon, right, which is like a highly subspecialized surgeon that I thought I would have a job in, a tertiary care medical center in the United States. I happened to have some medical problems myself, and I had surgery, and I was injured by the surgery that I had, and suddenly, for like health and physical reasons, this sort of path that I thought I was going to be taking, appeared to possibly not be feasible for me anymore. And so through various experiences that I had in the Lake Tanganyika Basin in the past, the kind of professional 180 that I did in my life, was this. So yeah.
And how long have you been? How long have you been doing this work with the clinic, like formulating the idea?
So this has been my full-time job for about 3.5 years, but I first had this idea the first time I visited Lake Tanganyika. That was as a tourist, an intrepid tourist, a crazy tourist, but as a tourist nonetheless. I had an experience there that kind of got my mind thinking, and that was in 2006, I guess.
Okay. Now, much of your work, like our work at the WDI Healthcare Research Initiative, deals with access to medicine, services, and health information. What do you feel are the bigger challenges that remain when we think about access, and how can we begin to address those?
Well, I think a couple of things. I think that infrastructural access is probably the easiest thing to design and to overcome, and probably is the most financially onerous. But I think that the next level of access, which has to do with relationship building, with, real capacity building of healthcare workers, patient trust, patient empowerment. Those are things that are extremely time consuming and require a lot more give and take and a certain amount of finesse. And so I think like if you have an endless pot of money, right, you can design any number of ways to overcome, physical access boundaries. But will those things that you design, be culturally appropriate? Will people trust them? Will they use them? That's a whole other question.
Yeah.
And it's one that we think about all the time. And part of the reason why, before there even is a ship, we have these relationships in the basin so that we feel that we're addressing the physical access issues with a method that's comprehensible and will work.
Yeah, that makes a lot of sense. Another one of the topics many of our healthcare seminar speakers discuss is how technology impacts their work in the field of healthcare. I know this is something you've written about a little bit before, so could you provide us with some examples from your work and how mobile health technology or internet access has impacted the work that you've done with the clinic and maybe some of your plans for the future?
I'm pro interesting technological ideas and definitely feel that they have a role. Where we start from, though, in the Lake Tanganyika Basin is probably about as basic as you can get in that a very large area of Lake Tanganyika doesn't even have cell phone coverage. So when we start talking about things like telemedicine and M-Health and that kind of thing, really no one has a phone. People can't talk to each other. So we have been thinking about how can we adapt certain kinds of already existing technology to establish the most baseline communication capacities between these little health centers and dispensaries and the regional hospitals that exist, inland and with us, so that we can sort of begin to open this dialogue of, if we can talk to each other a little bit and we can text each other a little bit, what does that lead to for us in terms of, levels of service, or how can we capture certain data that are very hard to capture otherwise without this kind of minimal communication access. In the future, when we have the boat, we will have an internet connection to the outside world and to all of the countries around Lake Tanganyika, and our goal would be to establish that kind of connectivity for these land-based centers as well. But we know that it's going to take a certain amount of time in order to do that.
Yeah. And so looking ahead as you begin this new year, outside of potentially working on access to this kind of technology and growth with that type of thing, what do you foresee as the next developments for the floating clinic, and what are kind of the big next steps, short term and long term?
Well, in February, we're actually going to be on the Congo side in the south, putting in this sort of proto-communications network, if you will. We will be linking up some of the far-flung little health centers with MOBA Regional Hospital. And so we're adapting some technology that's used by mining and oil and gas companies to send, certain amounts of, information, both with voice and texting, using radio and some satellite signal. So we'll be installing that, shortly, and I think we're very interested to see, how that ends up being used and what information we get as a result of sort of doing this initial net, small network.
Yeah.
We have some other outreach projects planned, including something that is, a little unusual for us. Is more of sort of an art installation and an awareness of the lake that we plan on doing in partnership with the artist called JR, who is a photographer and has done these huge public installations in many large cities around the world, as well as in the favelas in Rio and in the Kibera slums outside of Nairobi. So we're planning to do a kind of installation, if you will, on Lake Tanganyika to bring more attention and awareness to the basin. And probably most excitingly, our naval architecture and engineering plans will be complete in a few weeks. And so we'll have these concept designs of, what this hospital ship will look like, the economic analysis of, the capital expenditures and the operational costs. And so, we'll be pounding the pavement with those plans.
That's great. That's all really exciting stuff. And finally, to wrap things up, one question many students preparing for their professional careers may wonder is, what one or two pieces of advice would you be sure to share with anyone looking to take an innovative idea and put it to practice? Are there a couple things that you would want to pass on to other students to help them make an idea a reality?
Yeah, go there. People should, people can have lots of tremendously exciting and innovative and interesting ideas, but your idea has to work in the context and the community in which you intend it to be used. And if you don't understand how things work in that context, you're going to have a much harder time with your concept and design. So go where you think you want to be and learn from the experience. There's a lot of information that's already out there. I think sometimes where humanitarian and development projects falter is with this very top-down external approach to solutions when, often, there could be plenty of fantastic ideas for solutions that are at the local level, and what people need is an advocate to help them develop those very solutions which will work for that community.
Yeah, that's great advice. Well, thank you so much for taking the time to talk with us and for coming here. We look forward to hearing more from your speech this evening, and we appreciate you visiting the Institute.
Thanks for inviting me.
Mm-hmm.